I've been fortunate enough to be a member of a small group of sport medicine clinicians who have gone to Uganda a couple times. Actually, I've joined lately. The team has been going for a few years. And we assess and treat some of their elite athletes and collaborate in some educational events for their sports medicine clinicians. CoRSU has been a founding supporter of that whole project. So as a center of excellence in orthopedic care, it was a natural for them to be involved in care of some of the elite athletes and for keeping the general population active. So we've been quite excited that they were interested in helping us with this. Even a country like Uganda, lifestyle diseases like hypertension, diabetes, obesity are more of a killer than infectious diseases. So it's important for the whole society to keep people active and to treat perhaps less serious things like arthritis and tendinopathies, so people do keep going. A place like Uganda, if you get debilitated to the point where you can't work or you're not mobile around the city anymore, that's a significant handicap and needs to be avoided if at all possible. Yeah, on our last trip, Dr. Blake Bogus, who's a sports medicine expert from Duke University in North Carolina, and I were giving an educational session to the orthopedic surgeons and orthopedic residents at CoRSU. Remember the session started with PowerPoint, and everybody looked kind of bored and quiet and sitting there, and we thought, oh, this isn't going to go well. But pretty quickly, these physicians started to see how they could use this point of care ultrasound in their practice, and they became pretty animated and jumped up and started using the probe. Dr. Bogus and I pretty quickly took our shirts off so they could examine our shoulders. And we learned a little bit from them, and we were both excited to see that this particular modality, which is very useful to supplement or even replace MRIs and CTs, was going to be of great benefit to them in their practices. CoRSU has become a rather unique critical mass of orthopedic excellence, and we would not want to lose that. Healthcare in any country is difficult to sustain financially, and CoRSU is just starting to get the expertise where people could deliver healthcare to the middle and upper classes who have the interest and usually the ability to pay for some of these services, and thus supplement in a viable way the overall healthcare. So yeah, we would hate to see those advances stop. So at this critical time when CoRSU needs some bridge financing so they don't collapse completely, just a relatively small donation to the GoFundMe of Keep CoRSU Open would be most appreciated. Hopefully people will follow the progress of CoRSU as it continues to deliver healthcare in Uganda, and also for those of us, our organization of Canada and Uganda Sports Medicine. Thanks for your time.